Hello, everyone. Today we are going to start in the third lecture in principle of health education. In this lecture, we are going to discuss about the direct and indirect method of health education. As you know, the health education it is a backbone of public health. It can help you to upgrade the awareness or upgrade the information, health information among the community and also among the people. In these lectures, additionally, with the health education can help us to prevent the disease and also to control the disease. In this lecture, exactly, we are going to focusing the method of the health education, how you can do the method. There is a two method of health education, direct and indirect. The method that means the tools or the way can let the community and also can let the individual to contact with them or to send a message. This, as I mentioned, we have the two method. One of them is the direct method and second is indirect method. Let us to go to next slide. It is also going to introduction to health education, as I mentioned before. Health education, the empowering individual and communities to make informed choice for the better health. When you are give the community or individual good information in the health, that can let them to get the take the good choice for them health. Yeah. Additionally, is a consider the health education is a consider as a vital process for the prevention of the disease and also improvement of the health of the community. Moreover, can increase the well-being of the people. Yeah, this is a vital process of health education. Now let us to see the direct method. What does mean the direct method of health education? The direct method is involved, or that means the face-to-face communication or direct interaction between the health educator and the learner. It is no mediator, just like you and uh, your community member. It is contact, direct contact, face to face. You see him and you also he see you. Then you send them the message. Like example, you can tell them you have clean your hand during the outbreak of the cholera. Additionally, you have to use a good clean water and eat clean food. This is a called direct method. It is not mediator. You see him and he see you. This is the direct method. The second method of the health education is the indirect method. It is not direct contact, or it is not you cannot see it, it is not face to face. It is means you can use the tools or media to disseminate the health message. This is the called indirect. It is not face to face, as I mentioned. Indirect, it is need mediator, or it is need the media, or need the tools to send the message or to disseminate the health message without requiring the direct personal contact. Yeah. This is the this is a brief of the direct method and indirect method. Also in this slide, also we are going to see why the health education is important. As he mentioned, one of the important of the health education is the fostering understanding of the disease. This is the one. Second, promote healthy habits or health attitude. Additionally, is reduce the community illness transmission. Last one, it is empowering individual to manage their own health. This is why the health education is method. In this slide, just were discussed about the direct method. As I mentioned, the direct method it is means the face-to-face between the health educator and the community members. It is face-to-face. It is not need mediator. You see him and you see you, and then he give you the message. This is the direct method. Secondly, is indirect method. It is need mediator or need the tools like video or radio, like television. This is the call it indirect. The person it is not in front of you. This is the call it indirect method of health education. Now let us to go to next slide to see the in this slide we are going to see the direct method education. What is the direct method education? As I mentioned, it is face-to-face health education, face-to-face between health educator and learner. And direct method, it has the many, it have the many ways. One of the direct method health education, it is the individual counseling. If you know someone and you need to counsel them, to give them awareness, to counsel them, this is the call it individual counseling. If you have your friend or your brother and he facing with some challenges, as a health educator, you can sit with him and give them counseling, how you can coping or how you can handle this problem here to give them advice. You have to do this, you have to do this. It is not good, it is normal. This is the correct individual counseling. Second method or second way of the direct method is the called group discussion. In the group discussion, it is a small of the group, like 7 person, 12 person. They can sit together in the community meeting, as in your at the community level or in your city where you are. You can sit with them. When you are sit with them, to discuss about the protocol of malaria. If you have the malaria, you have used this or this drugs. Also, you can discuss with them about the prevention method of the cholera, like clearing your hand, eat the good food, no eat raw food. Additionally, use give them. This is the quality in the group. Call it the group discussion. This is the second way. The third way is the lectures. Also, the lecture like right now in the lecture because we are face to face. You are see me and also you are see you and disseminate you information in health education. This is a call it lecture or talk. This is a large presentation of the audience and explain them, give them the advice, give them the information. This is the call it lecturing. The demonstration, that means you have the big hall and many people is there, and then you can discuss proper discuss the health issue in the big way. This is the call it demonstration. Yeah, demonstration. Another way of the direct method of health education is a home visit. Sometimes, or like nowadays, when you see the cholera outbreak is taking place among the community, the volunteers or health volunteers they are doing the round in their community, and they are going home to home and send them the message. These days, there are outbreak of the cholera you have take care for your child or your kids to clean their hand, to eat good food, to avoid them. This is the home visiting. Also, this is the way of the direct method. We have the five way of the direct method of health education. One of them is the individual counseling. If you have your friend and you need to counsel them, your friend is facing with some challenges, then you counsel them how you can handle this or how you can coping this issue. This is the one. Second way of the direct method, it is a group discussion, like more than 7 person or 12 person. They are sit together and discuss health education message to send to tell them, to give them or to disseminate the health information. This is the call it. This is the call it group discussion. It's more than seven until like 12 person. This is the call it group discussion. Addition way for the direct method of health education is the lecturing. Lecturing, as I mentioned, like this, and demonstrate to disseminate the information. Moreover, the demonstration, many people doing practical and send the health message. Last one is the home visit. As I mentioned, you can go home by home and send or disseminate the health information. This is the called direct method of health education. Now, let us to see the advantage of the direct method of health education. One of the advantage of the direct method of health education is the immediate feedback and clarification. As I mentioned, the direct method is the face to face. Some person is in front of you when you give them the information, or when you are send them the health message. It can directly give you feedback, like ask them, what do you understanding about the prevention of the cholera? He can tell you tell this because he already can give you direct feedback. It is not mediator. Yeah, this is the one of the advantage of the direct method. Second one is build the trust and rapport. When you are sit and discuss with your community face to face, that can increase the trust with them, they increase the confidence with them, and can explain you more and ask you more how you can handle their health issue and health problem. Yeah. Moreover, advantage of the direct method of health education is the customized to audience need. Yeah. Yeah, you can know the real need of your customers or your community. This is call it the direct method. Additionally, the facilitator behavior change. The facilitator of the behavior change, the facilitator of the behavior change. Yeah, we have the some internet problem. We can continue, yeah, until the internet will back. Yeah, the facilitator of the behavior change. Customize the audience need. Additionally, can facilitate the behavior change. Facilitating the behavior change, it is can help you to change the behavior of your community. This is the advantage of the direct method of health education. Secondly, let us to see the disadvantage of direct method of health education. One of the disadvantage of the health education is going to take the times and also the more intensive. Yeah. This is the one of the disadvantage. Secondly, requires the training and professional. Those person who is going to do the health education for the volunteer or for the community, it is need to have the good skills that can help them to disseminate the information about among the community. Last, last point of disadvantage of direct method of health education, it is limited to reach large population. During the direct method of health education, it is difficult to reach a mass population or large population. Just you can face or can meet the specific people. This is a disadvantage of the. This is a disadvantage of direct method of health education. Yeah. This is a disadvantage of this one. Now let us to go to see the second method of health education. Now you can see the next slide. We are going to discuss about the indirect method of health education. The indirect method of health education is leverage the various media to spread the health message widely. By indirect method, can use the media and help us to disseminate the information widely. Additionally, it can minimize the need of the personal contact. It is not going to do the send of the message by the direct people. Moreover, these approaches are effectively for the broad dissemination and reinforcing key information. The common method of indirect, uh, the common, the common indirect method is we have like four. One of them, the print media. Let me to check. Hello, hello. I think we are losing internet. Huh? Let us to continue. Yeah, let us to continue. Now we are finished the slide of the direct method of health education. As I mentioned, the direct method is going to send the method face to face. Yeah, and we are mentioned there is a five way of health education, five way of direct method of health education. One of them it is the individual counseling, as we discussed it. Secondly, group discussion. Third is lecturing. Fourth is the demonstration. And last one is the home visiting. Additionally, we are discuss about the direct method. One of them, direct feedback. When you send the message among your community, directly you can get the feedback. This is the one advantage. Secondly, can build the trust with your volunteers or with your community. Moreover, can realize what their need exactly. Your community can understand very well. Moreover, it can help you to change the behavior of your community to good behavior. This is the advantage of the direct method. The second one is the disadvantage of the direct method is going to take the time. Moreover, requires the professional person to send this health education. Moreover, it is difficult to disseminate the information to the mass or the many people in one place. Yeah. This is the disadvantage of direct education. Now let us to jump into to indirect. method of health education. As I mentioned, the indirect method of health education, it is need the mediator. It is no contact with the community directly face to face. Yeah. It is need the mediator. And also in indirect method can help you to send the message to population of the people, many people in some place in the same time, as you see right now with the Facebook and also with the WhatsApp or with the many things here. It is I think my voice is it audible now. Okay, let's go. In second method of health method of health education, it is indirect method. As I mentioned, in indirect method, it is not going to send the health. It is not going to send the not face to face. It is need mediator to send them the message. Additionally, in indirect method of health education, you can send the message in same time to mass of people, of large of the people. Like you can see with the WhatsApp or Messenger or Badruddin, you need to say something? Hello?
Uh,
Yeah, welcome.
about
Yes?
disadvantage
Yes?
about the direct disadvantage
Disadvantage of what?
of direct message.
Okay, okay. Let us to revise again. Let us to finish this, then you can go back again. Doesn't matter.
Oh, oh, okay, nice.
Yeah, yeah. The second method is the indirect method of health education. As I mentioned, with the indirect method, we are going to send the message with the different or mass of the grouping people. As you know, right now with the Facebook and WhatsApp, you can send the message for the huge number of the people in same times. Yeah. Secondly, let us to see the common direct method, common indirect method way. There is a like have four way of the indirect, like print media. Print media that means you can have the poster or chart. Yeah. You can like paper like this here and write the health message like prevention of the cholera and send them write them here and give this paper to the people. This is a call it like leaflet. And additionally poster is a big poster. They are put it in the main gate or main road. If you see in the city or in there, send the message, clean your hand like this here. This is the call it the print media. Yeah, print media. This is one of the indirect method. Additionally, we have the visual medium. Audio visual. Audio that means you can hearing, and visual that means we can see. Like radio program and also television. Additionally, educational videos. All this called is the audio visual media. This this is a second way of indirect method of health education. Additionally, the digital media like website and social media like Facebook, YouTube, WhatsApp, all this called is the digital media. With digital media, you can send the message to the group of the people or the many people at the same times. Yeah. The last way of the indirect method is they call it exhibition and health fair, even with the both information and checkup and demonstration. Yeah. This is the four way for the indirect. As I told you, Indirect, it is not face to face with the people or with the volunteers. Yeah. It is needs the media. One of the way of the indirect is the print media, and I mentioned like poster and like poster and also like a charger. Now let us to see the advantage of let us to see the advantage of the advantage let us to see the advantage of the indirect method. One of them mass reach and repeated message can send a message with a different or big group of the people. Additionally, the cost effectively and wide coverage can cover the many people and also with the low cost. Yeah. Additionally, the effective in the areas with low literacy. Yeah. If there's some area the literacy is very low, can also help them to use this media, and this media can help them to send the message. Last point, we can see the disadvantage of the indirect method of health education. One of them lack immediate feedback. It is difficult to get feedback from your listener or from your receiver. Secondly, my not reach under surface area. It is can send this message for the different people and even can send for the untarget groups. Yeah. Additionally, potential of the message is misinterpretation. Sometimes, if the message not prepared very well, it is difficult to get to understand very well. Yeah, it is difficult to understand very well. Yeah. Now let us to go to next slide. In the next slide, we can comparing between the direct and indirect method. We are comparing direct and indirect method. One of them in the contact in indirect method is the face to face, and this is the direct method. Indirect method, no person contact. The consent for the feedback. In contact, in direct method, immediately can give you feedback, but in indirect method, it can be delayed. Yeah. Reach out. The direct method is can cover small group. Indirect method also can cover it. Direct method can cover it small group, but in indirect method can cover it the large population. The cost is high. It is high because needs the staff and also needs the time. But is the indirect method is the low because materials one is made. Moreover, flexibility. Indirect method, the high adaptable message, but it is in indirect method is low or fixed message. Best for behave person. The direct method is the best for the personal behavior change, and consent for the indirect is the general awareness. This is when can you use each method. Indirect method can for sensitive topic like sexual health, high risk group like pregnant women or behavior change. This can mainly can use this one. While in the indirect method for the general health message like washing hand, rabbit mask outreach, or budget limited scenario. Yeah, this is our lecture we are handled or we are covering today. Yeah, as I mentioned, we have uh, we have This is the last point in our lecture of today. Okay, now can let the we are talk in this lecture today. We are discuss about direct and indirect method, and we go through the direct method is involve the face-to-face interaction between educator and learner, and offering immediate feedback, while in indirect method is utilize the tools and media to disseminate the health message broadly without requiring the direct personal contact. Why the secondly also we are discuss about the health we are discuss about the why the health education is important. One is the fostering understanding disease. Additionally, promote the health habits. Moreover, they reduce the community illness transmission and also empowering individual to manage their own health. After that, we are go through the direct method.